Welcome everyone and welcome data hunters to this event, Fantastic Data and Where to Find Them. My name is Miriam Sadon and I'm here today to introduce you to the almost magical health information portal and show you how it can help you in your work. So the portal was first launched in May 2021 and it has been growing extensively since its launch. Both at the content level, as more resources and information is available on the portal, but also at the technical level, making sure the portal can connect to other platforms worldwide. This is fantastic and it did not require any sorcery, but only the support of 27 countries across Europe and all the other researchers that came to the portal and were happy and wanted to contribute to the health information portal. So what can you expect today from this short event? So I will start with the origin of the portal and with an introduction to all its main different sections, and we're going to go live on the portal. After this, my colleague Bartolomei will provide you with a short overview of the visitor of the portal. And finally, we have invited a data science from Cienzano to help us do a little demonstration on how the portal could be best used. So if you want to tweet during this event, please feel free to do so and use the hashtag health information portal. We will make sure to retweet your tweets on our project page. With this said, I think we are ready to start with this event. With this, I would like to start with a little bit on how the health information portal came to be. Like, what was the reason behind the health information portal? Well, basically, for many years, experts across Europe were coming together and to discuss what were the main issues in the public health field when performing research. And of course, this discussion had identified a lot of barriers and drivers, but one point the most experts could agree on was the data across Europe and worldwide, it's hard to find. And this makes then hard to access the data and also to reuse it. So given all the resources necessary to be able to set up a study and collect the data, we basically wanted to make sure the data could be collected once, but then reused many times to make sure we could increase the value of the data itself. So from this concrete need, the Health Information Portal was born, a one-stop shop facilitating the access to health and healthcare data, as well as expertise across Europe and worldwide. This is achieved through the development of metadata catalogues on data sources, on research projects, on trainings in all the field of capacity building, and also with the provision of a diverse set of tools that help researchers to perform the research. With this said, I will now share my screen and I will bring you to the Health Information Portal and show you actively what are the different sections within the portal that could be of interest for you. So I believe in a moment you should see my screen. And now we are on the home page of the Health Information Portal. The first things you can see is a full text search, and this can be the entry point for any researchers that comes about the Health Information Portal and he wonders what type of content it provides. So you can just take a look as well. The only thing that you need to do is type healthinformationportal.eu and you will be brought here. Now, to just go a little bit more into details on what are these tools that the Health Information Portal provides. Well, to start with, we have here just an About section that is a little bit of an introduction on the Health Information Portal and who manages it. Then we go to the first section that is dedicated to COVID-19. Basically, during the pandemic, the experts that had the same idea to set up the Health Information Portal, they were really coming from all the countries across Europe. There were also some of these people, the one that would be advisor to policymakers in their own country on what type of policy should be implemented in the country to basically manage the COVID-19 pandemic. But what they could see is that they would really need to exchange information and expertise with other experts across Europe. And this was done with the Rapid Exchange Forum, which is basically a meeting that takes place every 2 weeks where policy makers and advisors to the policy makers coming from Public Health Institute, from the Ministry of Health or Research come together to address urgent COVID-19 questions. So those were all the things that when in the beginning there was not a lot of information on COVID-19, the question were like, what is being done in your country? What can you tell us that we could also learn and implement in our country? And this really concretely helped policymakers to take better decisions as they could exchange with other experts across Europe. As we move out from COVID-19, this network, as is well established, is also being used to address questions beyond COVID-19 and in all other fields of public health, as it really proved how this network that is connected to Public Health Institute in Europe, Ministry of Health and University really was capable of finding the right information depending from the topic and the expertise to answer the questions. The second part that is dedicated to COVID-19 is an overview of the COVID-19 policy measure page. Basically, here you could find all the most up-to-date links on what type of policy measures they were implementing in the different countries. And this was extremely useful, again, to see what was happening in Europe and in other countries and see what a country could learn and also implement in their own countries. So this was done by the provision of the national expert at the national level with the link where the information would be updated most frequently so that the information would always stay up to date. Then moving on to the next part, here you can filter information per country. So the first tab we have already seen, while the second one focuses on the national nodes. And basically the national nodes are all the experts. It's a connection of institutes within the countries that share information on health information system. And basically, by selecting any country that you see marked in dark blue, both here or using this drop-down menu, you can learn how a health information system in the country is organized, and also what are the main data sources or what are the main registry available in the country that the country collects information on. Then moving on to Search Europe, we really are aware how there are many health initiatives going on at the European level, but how those might not be well connected. And in this case, a lot of duplication of work might happen as researchers might not be aware what other initiatives are going on. So in this tab, we really try to provide information on other European initiatives, research infrastructure, international organization, and European Research Network that perform research on public health, and that you can filter per topic, so to make sure that you always have the opportunities to ask other experts across Europe and worldwide more information about the topic you're working on. The next session really brings in developing further skills in our data hunters. So basically, you might be interested in developing deeper your skills in some specific research methodology that you are not well aware of yet, or perhaps you want to learn more about a different topic. So this is a catalogues that provide information on different type of capacity building and training activities that are going on at the European and at the worldwide level. And so by clicking to by filtering first or by going directly to one of these sections, you can learn more about the event and then how you can, for example, subscribe to it. To make sure that your skills always have the opportunity to get updated and you have the knowledge necessary to perform the research that you want to. Then finally, we get to the tab services. And here for the data hunters, it is probably the favorite part, as they really have the opportunity to find fantastic data all across Europe and worldwide. So these are different tabs that already filter you the information for the content that you might be interested in. And of course, you can apply further filters to make sure you get the information you want. At the same time, you can find also some publication related to the field that you're looking information on, but also the European initiatives, as well as information on how to perform federated research. federated research. And basically, this is it's a new way to perform research. Data does not need to move from country to country, but you can perform comparative analysis by harmonizing your data at a national level with other researchers in different European countries, and then shares a common data model or a script to make sure that you can perform the same analysis. And this really allows you to have comparative results. So, and this can be really useful to understand what is the situation in a specific country or in Europe on the topic of choice. And finally, you will also find a session on health information system assessments. I will believe is extremely important for a country to be able to understand the strengths and weaknesses in their own country. So also the experts that are part of the health information portal can be contacted to really set up an in-depth health information system assessment if the resources allow. Then finally, to conclude, we have two small sessions, two more sections still. One is the glossary that provides you with all the keywords that have been used into the portal, and it really helps you to find some precise definition on concepts that sometimes might not be very familiar to you. And finally, we have a contact part. So here you can find a form that you can use to very quickly send us a message that it can be feedback, but also it can be you wanting to contribute to the health information portal. So if you want to make sure that also your data or data sets gets found, you can use the health information portal to make a metadata record and expose this information. One point that I would like to stress, however, is that we don't provide the data itself. However, we provide information about the data. So this means that we provide you with a description of the type of data that is available, but also the access procedure. So how can you access the data, and with the contact details of the expert that manages the data, so that you can really get in contact with him or with her and find out more on how you can have access to this data. All right. With this said, now I would like to give the floor to my colleague Bartolomé, as he will provide us with a little more information on the users of the portal. Basically, the work that we do, we really want to make sure that it's valuable and that other researchers across Europe are using it. And to do so, we closely monitor the users of the portal. So please, Bartolomé, the floor is yours.
Thank you, Miriam. Do you hear me well? Do you see my screen well?
Yeah, we see your screen. At the moment is white, but please go ahead.
Great. Thank you. Good morning, everyone. I'm excited to share some amazing numbers about the Health Information Portal. Since its launch in May 2021, we added more and more features on it, and we gained more and more users. And I am thrilled to announce that we have now over 14,000 users on the portal. So over the past years, since we celebrated its first anniversary in May 2022, we have seen an incredible rise of 68% of the portal visitors. And thus, we are really happy to see that more and more users are using the Health Information Portal, but also to show that your dataset can have more visibility for potential researchers across Europe, and so that we can really together contribute to foster population health research around the globe. And as we aim to add more content, more features, and to improve the user experience on the portal, we also encourage you to provide us with feedback on the Health Information Portal at cienzano.be. So don't hesitate. Back to you, Miriam.
Thank you very much, Bartolomé, for this nice overview. This really show and give us motivation to continue to work on the Health Information Portal, as we can see how many other researchers across Europe and worldwide are making use of it. With this said, now I would like to call our researcher that we have selected to help us demonstrate the use of the portal. So the data hunters for today is called Nienke Schutte. So Nienke, please, if you're out with us, turn on your camera and then I will put you on stage.
Thank you, Miriam. Good morning, and thank you so much for calling.
Thank you, Nienke. Can you please introduce a little bit yourself?
Yes, sure. So my name is Nienke Schutte. I am an epidemiologist. I work at Cinsano, which is the Public Health Institute in Belgium. And I would like to focus my studies on conducting research on the impact of COVID-19, of the COVID-19 pandemic on cancer care in Europe and diagnosis of cancer patients.
All right, this sounds extremely interesting. So if it's okay with you, I would like to ask you to share your screen and go onto the Health Information Portal. You can do this by typing www.healthinformationportal.eu. Okay, I think the content is slowly coming. For the moment, we still see black, but perhaps it will appear any moment. And if you want, you can also turn on your camera so that we can see you. All right, Ninka, now we see you, but we still see somehow that you're sharing black content. That's a bit odd. Try to share again. Let's see how it goes.
I will share my screen. Here we go.
All right, I think it's coming. Yes,
Great.
wonderful. So now we can see you and we can see the health information portal. So
Fantastic.
Great. Wonderful. So you were saying that you're interested in performing research on the effect of COVID-19 on cancer treatment in Europe, correct?
That is correct.
Perfect. So basically, there are different ways you can find some content that could be useful to you. You can either use the full text search that you see in the middle of the screen. Otherwise, if you're already interested to filter the information per country, you can use the menu on the top of your screen and filter per search country. Or otherwise, you can just use the magnifier on top of the right screen. So just choose one of these options, the one that you prefer.
Okay, let me then try here just cancer, just a very general word to see what's out there.
All right, as you can see on the left side of your screen, there is a bar that is called category. And basically there you see all the different type of information that is available connected to cancer. So you can find data sources, but you can also find capacity buildings, but you can also find other European research networks that focus on this topic. So feel free to just filter or look a little bit around on what you think it could be relevant for you.
Okay, so I'm looking for data sources to support my research. So I think here I would just select data / health information source, as I think this is what I'm looking for. Ah, I see it filtered out 42 sources. Let me scroll through. Ah, there are many cancer registries and cancer statistics available. Amazing.
Yeah, so feel free to just select one that you think could be relevant for your research, as in this way we can go a little bit more into details on the type of information that is provided within.
All right, let me then maybe select just the Belgian cancer registry. This is the cancer registry in my own country.
Wonderful. So as you can see here, there are 4 main tabs: overview, demographics, datasets, and content. In the first one, you will get the general information on the description of the health information source. You will get some keywords, but also some information about the governance and legal framework. And at the same time, you will also find information on the funding and the URL to the origin of the source. In the next tab, you're going to have some information on the demographic. So for example, what type of patients are, like what is the target population and what type of characteristics are inside the data sets. Moving on to the part that is called datasets, you find very valuable information on how to access this data. So if by reading here and by going to the original website, you see, okay, this is the type of information I would be interested in to perform my research, well, then you can find out how you can access this data. And if the information there should not be enough, you can go to the tab that is called content and find there the contact details of the expert of the data managers that take care of this data source. So in this way, you can get in contact with them to ask them questions.
Ah, perfect. So I can just send them an email to ask for more information about how to get access to the data.
Exactly. So these are really the data managers or the people that know more about this data source. So you can always go back to them to ask for more information.
This is great. This is already a lot of information about the data sets that I might need. So how did this came about? How did you decide on which elements you should include here?
Well, basically, this is a really good question because it took us a lot of time to agree or to come up with a final template that anyway we continue to improve based on the feedback from different researchers across Europe. But really what we wanted to make sure is that our template is interoperable and it follows metadata standards that are internationally agreed on. For this reason, we have developed a template that it is specific to health information and population health, but it's mapped to DCAT metadata standards, which is a standard that is implemented at the European level to make sure that the information available there is interoperable, so it can be connected with other templates available to other websites that use the same metadata standards. And this was a long process with a lot of discussion with the selection of the fields, but we really tried to provide information that we thought would be most relevant for our researchers like you.
Okay, perfect. So if I go back, I can look for other data sources. I see Malta, I see Austria, Finnish Cancer Registry. All right, let me check this out. Also a lot of information available.
Exactly.
Linkage possible. Fantastic.
I'm glad to hear you're enjoying this. And if by chance you're also interested to really know how, for example, the health information system of Finland is organized, because you might be familiar with the one from Belgium as you work in Belgium. But if you want to learn more about the Finnish one, you can go, for example, in the top menu, you can go under Search Countries and then select the tab that is called Search National Nodes. Here in a moment, you will be brought to a map of the European countries, and basically you can select any country you're interested in, for example, Finland, as we just had a look at it, and you can either select it from the drop-down menu or from the country itself. Okay, so here you are gonna get some information on how the health information system is organized as such in the country and who is the contact person in the country. At the same time, you will see the information is already filtered so that the data sources are available in the tab that is on top of the screen next to info. And next to it, you will also find some key reports on the health and well-being of the population in Finland, as well as some key portals that are available in the country for finding more information, because we really want to make sure that we can connect with other initiatives and other platforms that share information. At the same time, you will also find national projects and associated European research network that perform research on population health.
This is fantastic. I think this FinHealth follow-up might be interesting. As I can see, there are already some keywords that I find of interest. Also, COVID-19 is listed there. And here at National Projects, I saw that there were already some studies about the impact of COVID-19 in Finland. So I think I'm going to check those out and see if I can find more information.
Exactly. And what you need to know is that the information on the portal continues to grow, because like the more researchers come to know the health information portal, the more interest we get from them to also share the information about their own initiatives to make sure that it can be found across the world. Now, another part that I think it could be interesting for you is the one dedicated to search training. So you will find the tab on top of the screen. And yeah, exactly. And you can click on Activities Catalog. So also for you here, you can try to check later on if there are information related specific to cancer. So if there are some capacity building specific to cancer, or if there are some capacity building related to new or specific research methodology that you're not a lot familiar with, but that you would like to get more information on.
Amazing. I already see a lot of trainings for COVID-19 and health, the effects of the pandemic, but also data science, advanced training on epidemic intelligence. Oh, okay, this is good. This can really boost my research. Thank you so much, Miriam. This is very helpful.
I'm glad to hear that.
So, and I have actually been collecting also a lot of data on my own. It would be great actually to put the information about this data set also online. Is it possible? Can I host it
Yes.
somewhere here?
Of course. So basically on the top right corner of the menu, we'll see there is a part that is called contact. So there you can just, if you click on content itself, you will be brought to a short contact form, and this is to make a first contact with us. And what we can basically provide you is with a template to collect the information on your data sets. The moment you provide us the information regarding your data set, so what is inside, how the data could be accessed, and who is the contact person, then we can make sure to add such information on the portal. And the big advantage for you to having your information on the portal is that the portal is also mapped to another metadata standard called schema.org, which in very few words, it makes sure that the content available on the Health Information portal is findable through other strong engines such Google or Yahoo and Microsoft. So this really can increase the value of the data because it can be found by other researchers, and this can really help you to basically share your results with other researchers.
That is amazing. Thank you so much, Miriam, for the explanation.
Thank you so much, Ninka, for being with us. All right, so this brings us already to the end of this short event. Today we do not have time to answer your question. However, we really encourage you to just send us a quick message on the Health Information portal. It's really easy, where you can share with us all your feedback, all your questions, and we'll make sure to reply to them in details and to provide you with the information or with the clarification that you might have on the portal. With this, I think we are at the end of this event. I would like to thank you very, very, very much. And I hope the new data hunters, the new generation, will be able to use the Health Information portal and all its fantastic tools to really boost your research. Thank you very much again, and have a nice start of the week.